My name is Grace and I'll be presenting on Miss Wells' case study. So Miss Wells is a 28-year-old African American with a long-standing history of asthma. She was diagnosed at age 2.5 and she is a former smoker. Her last marijuana use was at age 21. So today she presents to the clinic because she has a near asthma attack 2 days ago as a result of cat exposure at her relative's house. At the time of the attack, she noted she had severe wheezing and shortness of breath, which lasted for about 5 minutes. Since the exposure, she has had persistent symptoms such as shortness of breath every 4 hours, night awakening due to shortness of breath twice every night, and also wheezing. She has albuterol, but only gives her partial relief. She reports that her symptoms has interfered with her LDAs, and she does not have spirometry or peak flow monitor or home nebulizer or vaporizer, and does not keep records of her attacks. Today, her vital signs are as follows. Blood pressure is 122/68. Heart rate is 78. Respiration is 18 and SpO2 97. She is alert-oriented and responds appropriately to questions. So her respiratory assessment, she has bilateral expiratory wheezing in the posterior lower lobes with no signs of distress. In the office, her spirometry is the FVC is 3.91 liter. FEV/FVC ratio is 80.56%, and SpO2 is 97%. Due to her symptoms of her frequent asthma symptoms, her nocturnal awakening, her wheezing, and also with her interference with LDA, I would diagnose Miss Wells with moderate persistent asthma. Following the GINA guidelines, using step 3 therapy, I would recommend Symbicort for both maintenance and relief therapy. Also, I would educate Miss Wells on the use of peak flow monitoring at home to keep records, and also refer her to an allergist to be seen. A follow-up appointment to be arranged in 4 weeks to assess her control of asthma and her adherence. Thank you.